Bacchus Hospital here in North. There's Tina Varona. Thank you so much for watching. I'm so happy to be joined this morning by Dr. Kyle McClaine. He is Chief of Emergency Medicine here at Bacchus Hospital. Dr. McClaine, thank you for being with us today.
Time.
Absolutely. So, data that you're seeing in terms of the volume. Tell me your concerns and why.
Sure. Our largest concern right now is that we've seen the emergency department visits continue to be inappropriately too low. When patients do come into the emergency department, we're seeing that they are in much advanced stages of their illnesses and injuries, where if they had just sought care sooner, they would have spent less time in the hospital, needed less. We're finding people that have to go to the operating room for infection.
Dr. McClaine, what type of illnesses are you seeing where treatment?
We've seen things so simple as a kidney infection or sepsis, where they could have come to the emergency department and just received simple treatment. We've seen skin infections from minor wounds and from cellulitis and abscess, things that progress to a much larger extent than they had to, where they could have been drained or just gotten treatment in the emergency department. We see people with fractures that don't seek care for days and have complications of their fractures. We've seen people that get into car accidents and traumas that don't come to the hospital for the first day and present with delayed injuries that should have been discovered on the first day.
So as an emergency medicine physician, when you hear these stories and when you see these stories, what goes through your mind or what's your reaction?
I think what I really want to tell people is that it is safe to be in the emergency department. If you perceive you have an emergency or you're not sure what's going on, you need to be here. It is safe to be here. We have all the protective equipment that we need. We've never run out of anything here. We've always had masks, gloves, gowns, shields. I have colleagues in other parts of the country, even in other New England states, who were actually asking if I could send them some masks and gloves along the way. At Hartford Healthcare, we've never run out of any protective equipment. We have processes in place that ensure safety. We have separate triages. We have the ability to segregate patients within the department. If we get a larger surge, we even have a tent and a trailer behind me here where we can provide alternate treatment. We have basically an unparalleled ability to flex and to segregate as we need. And the truth of it is, we've been so successful, we haven't had to use half of this capacity. So the message I'd like to get out there is that it's safe to be here, it's appropriate to be here, and we'd like to see patients come sooner so that they get the best care.
And you mentioned flex, Dr. McClaine, and that's exactly where we're standing outside of the main entrance of the emergency department, and then over here to our side is the trailer that you guys really utilized during the height of the pandemic. Not so much now, but when you notice if that surge capacity were to happen again.
Absolutely. We have the ability to set up a completely second place where we can screen patients and send some home or channel them into a segregated part of the emergency department. Basically, almost 13 beds of capacity in the trailer.
And so let's, if we can show, so here is the main entrance to the emergency department, and then they would enter down there if you had to mobilize the tent again.
The entire trailer is negative pressure, and that would be a place where we would take a highly suspicious patient for COVID and controlled. It's very safe, very clean, and we have the population from patients in the emergency department who are low risk.
And then at that point, you would be greeted by somebody like Meghan here, who is a nurse here in the emergency department. And Meghan, thank you so much for demonstrating the full personal protective equipment. Tell us what you have on here and kind of demonstrate for us.
Sure. So even just as simple as we were suspicious of COVID, a face mask, which is under my shield here, and then depending on the types of procedures going on in the rooms, you might see a nurse or a provider come in with a face shield on like this, or a slightly different mask underneath called an N95.
And Meghan, how is this PPE protecting you and protecting the patient?
Right. So it in theory, it protects me underneath, so the germs are not landing on me. And when I come in and out of the room, I would take off the clothes that would be carrying the germs. They would go into the garbage can, and as I would come out, I would essentially be COVID-free, right? The patients always have masks on. Our staff always has a mask on, so it protects them, protects me. And as I leave the room and take my PPE off, when I go in and see the next patient, I'm clean, so I'm not cross-contaminating between patients.
So Dr. McClaine, so back to the tent. Thank you, Meghan. We appreciate that. So back in the 10, if this were to be mobilized, you'd see somebody like Meghan come in and in full PPE. And now, if somebody were to walk through the main entrance of the emergency department and you go through a screening asking you if you've traveled, if you say yes to any of those questions that you think might be COVID, what happens?
So we have a process by which if someone is not wearing a mask from the community, they're immediately for coronavirus. They are actually brought not to the waiting room, but directly into the ED. And we have flexible areas in the ED. We start off with a small area and we can expand it as necessary to basically cut the ED in half or even more if we need to, in which you're brought directly to that part of the emergency department where you don't have to wait, you're not around any other patients, and you're brought to a private room. And we have some that are negative pressure for the highest risk as well. So the whole process right from the door is you identify risk, you apply a proper mask if one's not already on, you do hand hygiene and bring them directly to the right spot in the ED. We still have a waiting room. Our waiting room is set up for social distancing, so for low-risk patients who screen out as not suspect for coronavirus, we still have everyone wear a mask. We still have social distancing. We've spread out the chairs in the waiting room. We've made it very safe for even those that don't have symptoms but still may be carriers. And we keep that level of concern. Virus testing to every patient. If you're admitted to the hospital, it's mandatory. If you're going to the operating room, we do a rapid test. If you're going to go home, so we help keep everyone in the know about their status. We keep everyone safe. We keep everyone separated as appropriate. Very safe place to be.
Absolutely critical information for the public to know if they are coming to Bacchus Hospital, if they need to come here. All of the safety measures and the protocols are in place.
Absolutely. Absolutely.
Well, we thank you for your time, Dr. Kyle McClaine, Chief of Emergency Medicine here at Bacchus Hospital, along with Meghan, our nurse who demonstrated our PPE. So once again, thank you for joining us. And as you heard Dr. McClaine say, if you do have a medical emergency, do not hesitate to come to the emergency department. It could save your life. Thanks for watching. I'm Hartford Healthcare's Tina Varona. Thanks and be well.